Hello everyone, I am Dr. Aarish Bali. I am a second year PG resident in medicine, and today I have got the opportunity to present a poster on the title Clinical Profile of Patients with Acute Myocardial Infarction in a Tertiary Hospital. This study was conducted at the Department of Medicine, Maharishi Markandeeshwar Medical College and Hospital, Kumarhatti, Solan. Um, as we know, atherosclerosis is a multifactorial disease involving the interplay of genetic and environmental factors. Cardiovascular disease is rising in low-income countries. Studies conducted to assess the prevalence of CV risk factors among different regions of the country show variation in different age groups of urban and rural population. The aim of the study was to study the conventional risk factors in patients of acute myocardial infarction presenting in a tertiary hospital. The methods used in the study were that this was a cross-sectional prospective study. 50 consecutive subjects were enrolled from the period of October 2019 to April 2020. History and examination with respect to risk factors like cigarette smoking, hypertension, diabetes mellitus, dyslipidemia, physical inactivity, obesity, psychosocial factors, diet, and excessive alcohol intake was done. Biomedical parameters like the lipid profile, fasting blood glucose levels, and postprandial blood glucose levels were obtained so as to identify the risk factors like dyslipidemia and diabetes, respectively. So here we can see the comparison of risk factor between the young and elderly study population. The parameters used in my study were the differentiation of the patients on the basis of their sex, on the which wall of the heart was involved, the area to which the patient belonged, the diet, whether they were vegetarians or non-vegetarians, whether they were smokers or non-smokers, whether they were alcoholic, and on the basis of stress, which included no stress, mild stress, moderate stress, or severe stress, on the basis of body mass index, whether the patients were hypertensive or not, whether they were diabetic or non-diabetic, and on the various biomedical parameters like LDL, triglycerides, total cholesterol, and HDL. The results of my study, the male comprised of 72% from the study population, while 70% of the patients belonged to rural population. 46% of the study subjects were either labor or farmer by occupation. Age-wise distribution of study subjects were 34 and 66% for less than 45 and more than 45 years respectively. Smoking was the commonest conventional risk factor to be present in our study population, followed by sedentary lifestyle and excessive alcohol. 36% out of these were obese. The mean BMI was 24.2. Hypertension and diabetes were 28 and 22% respectively. The mean HDL was lower in our study population. The risk factors such as smoking and alcohol were found to be significantly more in younger population, that is less than 45 years, as compared to the elderly population. Lower value of LDL cholesterol was seen in urban population. 80% of study population had 5 or more than 5 conventional risk factors. The conclusion was that from the above study, we conclude that smoking and sedentary lifestyle were the most common conventional risk. The present study highlights the need of a better design, large population-based case-controlled study so as to identify which amongst the conventional modifiable risk factor is independently responsible for acute myocardial infarction, initiate measures to raise awareness about the risk factors among the general population. With this, I end my poster presentation. Thank you very much.